Good evening, everyone. This is Dr. Mesheca coming to you live today. I'm just coming to do a quick check-in to see how you all are doing. I just happen to be in my office today. We're getting a lot of admin things done, and we're so anxious to open our office again. So I just had it on my mind to talk about how to be prepared to open your office. So let me introduce or reintroduce myself to you. My name is Dr. Mesheca. I'm a leader in optometry for over 20 years. I help doctors and healthcare organizations to optimize their staff so that doctors can focus more on patient care and revenue and less on staff management and development. So I do so through my coaching, through my signature workplace workshops and retreats for medical offices, and now through my best-selling book on Amazon, Fix My Staff, Tools to Create and Retain an Unbreakable Team. So I just wanted to come on today again just to talk to you about some things that we're doing. We are really anxious about opening our office. Like I said, we're here today doing some admin things. There were some urgent cases that had to be attended to, but I wanted to, just let you know, if you are a provider out there or a healthcare organization, that this will pass. We are all getting back to work soon enough, so we want to be prepared to be able to work. So let me just show you a couple of things that we're doing because, I'm here to talk to you about optimizing staff. So these are some of the things that we're doing to try to keep our staff safe as well as ourselves as the doctors in the practices. So first, we bought tons of gloves. The good thing about now that, COVID-19, we've been talking about this for weeks, you can now get a lot of PPE online, the personal protective equipment. So we got lots of gloves for our staff. And, most of the time they're probably going to wear them all day long or, of course, change them all day long, so that there is a barrier protection between anything that maybe they may be exchanging with the patients. So the other thing that I thought was really cool that we bought was this. Okay, so we got an infrared thermometer where we can check the temperatures of the patients that come in, as well as our staff. So we can check everyone's temperature to make sure that the patients coming in aren't sick, make sure the staff members aren't sick. So this is a really good thing too, okay? We were able to get a lot of the surgical mask. The N95 mask is still kind of difficult to get. We as optometrists, we are in close contact with patients, but, it's been said on the news to try to reserve those N95 masks for the doctors that are actually at the hospitals. But these ones, they offer some protection. They're better than nothing. And then one last thing that we got to help protect our staff members as well as ourselves is we got this. So it is a face shield. So as I put in the comments, that April is National Facial Protection Month. I didn't know such a thing existed, but there is such a thing. And I posted earlier about how face shields offer an added layer of protection against the respiratory droplets that are in the air from the COVID-19 virus. So we have one of these for us, the doctors, as well as for the staff. Let me just kind of demonstrate here. And yeah, it's not as great. It's not that great for your hair, of course. Let me take this off. But I just wanted to kind of demonstrate it. But it's really cool. These you can also now, I see a lot of these online. There are certain sites where I still see them. They're not sold out. So it may be a good idea just to kind of get these for your staff members as well. In fact, I think I'm going to order some maybe for a couple of my family members, just so that they can have them. But it does offer an added layer of protection. We are very close to our patients when we're working. So even with the surgical mask, these not being N95, they're not really blocking all of the respiratory droplets, but this is definitely an extra layer of protection. So why do we want to get all of these things for our staff, right? Well, we want to get them because, one, we care about them. Because we are so anxious about opening our practices, we have to give our staff members some level of comfort knowing that when they come to work, they are going to be protected since they are going to be around patients. And that's going to help to reduce sick time as well. Because again, we don't want our staff to be sick. Because our offices have been closed for so long and some of us have lost a great deal of revenue. When we come back to work, we want to be able to come back to work and, stay working and not have our staff members out on sick leave. So just do the best at what you can to help protect yourself and your staff members by going online and ordering some of this stuff. And again, this is probably one of the best investments I think we made, the infrared thermometer. Because again, you can check the temperature of your patients, your staff members, yourselves. Of course, if your staff are sick, you don't want them to come in. You want to reiterate them. But I think now is the time because we are hoping to all be back to work as soon as we can, within reason, of course. So use this time to go online and start searching for some of these things. If you want any more information about where I got these products, just send me a message and I'll let you know. But again, I was just coming to check in with you. I'm Dr. Mesheca. I help doctors and healthcare organizations to optimize their staff so that doctors can focus more on patient care and less on staff management and development. You can follow me on all social media at Dr. Mesheca. That's DrMesheca. And thank you all for joining me last week for my book launch, and thank you for helping to make my book a bestseller. So for now, have a great evening. Bye.